So hello and welcome to my YouTube channel. This is Nursing with Koi. My name is Wangoi Mwangi and I'm a Kenyan RN. I do videos on nurse education, patient teaching as well as health education. Today I come back with a video on patient teaching on blighted ovum, and this was a request from one of my friends and I will cover it shortly but information loaded. So please tune in and subscribe, hit the bell icon so that you're notified every time I upload informative videos such as this one. And if you're a returning subscriber, know that I deeply appreciate you. So let's dive right in. A blighted ovum is a fertilized egg that attaches to the uterine wall as in a normal pregnancy but never goes into developing into an embryo. The gestational sac, however, which contains the egg, continues to grow and form. However, the embryo will not grow, will be absent. This is known as an embryonic pregnancy and will ultimately end in a miscarriage or spontaneous abortion, sometimes before even the woman knows that they're expecting. So this is what happens with a blighted ovum. We have the uterine cavity or the uterine wall where the fertilized egg will attach or implant, but however this fertilized egg did not develop, or the embryo in the blighted ovum is not developing, and therefore it's just an empty sac or an empty gestational sac, and that has attached into the lining, as you can see. So this is a visual comparison of normal pregnancy to an embryonic pregnancy, and what happens with normal pregnancy is that there will be a normal gestational sac that has an embryo developing. As you can see, there's a fetal pool in the first diagram compared to the empty gestational sac in an embryonic pregnancy. To understand the pathophysiology of a blighted ovum, it is important to know the normal, and this is where a zygote divides and part becomes the embryo, part becomes the placental tissue or the trophoblast, and part becomes the amniotic membranes. When there is a blighted ovum, however, the trophoblast will develop alone without the development of the embryo. Then this blighted ovum is also referred to as an embryonic pregnancy, and nearly half of spontaneous abortions, of all those very early spontaneous abortions, are associated with a blighted ovum. It is likely caused by abnormal chromosomes, which are very prevalent in the general population. So causes, chromosomal abnormalities have been known to cause fertilized eggs. Abnormal cell division, on the other hand, could also cause abnormal division, could lead to a blighted ovum, and this could either be because of a poor egg quality or poor sperm quality. There is no evidence that a blighted ovum is caused by anything the parents did or did not do. So it is there is nobody to blame for a blighted ovum. In most cases, the blighted ovum will be just a once-in-lifetime occurrence and therefore may not occur again in the pregnancies of that woman. But in some very rare cases, you may have one woman having multiple cases of blighted ovum. Usually, there are no symptoms associated with blighted ovum except when the abortion is happening or has happened, and usually this is called a missed abortion or a missed miscarriage. The symptoms therefore will include vaginal spotting and bleeding, abdominal cramping, and blood clots or grayish tissue passing from the vagina. Sometimes this could be still very mild and the woman may not even know that they're experiencing an abortion, not unless they go for a medical checkup. So when it comes to diagnosis, if we rely on blood tests, especially the pregnancy test, will show that there is a pregnancy that is viable, because they will show HSG for normally progressing pregnancy. However, the blighted ovum will be confirmed by an ultrasound scan, and usually this is usually a routine ultrasound scan that is done early in pregnancy to determine the fetal morphology, and this is usually the first scan that your gynecologist will refer you to do, and then this will be caught during that scan. However, it can also be caught if you have all the other symptoms I have listed as for blighted ovum in this video. So this kind of miscarriage usually is discovered between the 8th and 13th week of pregnancy, and usually during an early routine scan. So unfortunately, a blighted ovum cannot be prevented, and some couples may want to do genetic testing following blighted ovum, especially if they have multiple cases of this. But however, there isn't much anybody could do just to rule out if you have the chromosomal abnormalities. Then a blighted ovum is often a one-time occurrence, and we rarely occur twice in one woman, but if it does, then there may be grounds for genetic testing. Most doctors will recommend the couples wait for at least 1 to 3 menstrual cycles before trying to conceive again after any type of miscarriage, just to allow the woman to heal basically. So when it comes to the treatment, there are 3 options. One is to just allow nature to take its course and for the hormones to subside and the miscarriage or the abortion to happen naturally, where all the products of conceptions will just come off the natural way. That is number 1, and is recommended for somebody who is not experiencing any symptom and is not in any immediate risk. Some women may want to speed up this process, and this can be done either through medical intervention or treatment using drugs or through surgery. Sometimes this could be recommended by your medical practitioner who knows your medical history, and therefore they will help you choose the best treatment for you if you're experiencing this. Another thing is, in case it's emergency treatment that is needed, you may not need to have any treatment. You can just wait for it to occur naturally, but if it's an emergency, then something needs to be done. So this, I'm going to keep it short and sweet, and that is the end of this video, and these are the references that I used. Thank you so much for watching through this video, for subscribing, for liking, for sharing, for commenting. It is because of you I do what I do. Please keep interacting with me in this comment section, and let's keep learning together. Thank you and bye.